Today I'm in the company of Dr. Humaira Badsha, and we're going to be talking about fibromyalgia. Welcome to the program,
Thank
Doctor. So for all of our viewers, including myself, who don't know what fibromyalgia is, what is it?
Well, fibromyalgia is a condition of chronic pain, widespread body pain, and no one can find the cause. All your tests come back fine, and a lot of women and patients who have this are told it's all in their head, you're crazy, go see a psychiatrist, which is not a great situation because the person knows they're not crazy and it's not all in their head, and they're experiencing this pain. So what actually is happening is that there's a neurochemical imbalance in the body. There's too much of the chemicals in your nervous system which increase pain, such as substance P, and there's too little of the chemicals in your nervous system which decrease pain, such as serotonin, norepinephrine, and dopamine. So when this imbalance occurs, I can just touch you and you yelp with pain because your nerve here tells your brain that that's painful.
Can this happen at any age, or is there
It's usually predominantly, interestingly, before I go to age, gender. It's a disease of women, 9 women for every 1 man affected.
Right.
And we see it a lot at different times of a woman's life. Just after puberty sometimes, so we have adolescent girls who have this, right after childbirth when your hormones drop, or around menopause. So there's definitely some sort of hormonal component, some sort of hormonal disorder which then contributes to the neurochemical imbalance.
for anyone who has or is experiencing fibromyalgia?
Yes. Well, you may not be diagnosed. You may be experiencing widespread body pain. You may be experiencing a lot of fatigue, poor sleep patterns. And you go to the doctor, they run some tests for rheumatoid arthritis, run your blood work, and say everything's normal. Maybe you should relax more, de-stress, enjoy life. But that's not the answer, because actually the answer lies elsewhere. You may need medication to set things right. You do need exercise and a good lifestyle modification, but medication also may be important in the situation.
Right. So when someone has a clean bill of health, but they know that there's something wrong, it could be this problem.
Yes, it could be fibromyalgia. So they should see a rheumatologist who should examine them, maybe run some blood work for arthritis, make sure nothing else sinister is going on, such as arthritis, hormonal imbalances, thyroid problems. And then they could diagnose them with fibromyalgia, a diagnosis of exclusion, and then actually knowing what they have is half the battle won here, and then getting on the right medication and treatment.
Well, thank you very much for this insightful information. If you've got any thoughts, comments, or questions about this webisode, please leave them in the comments section down below, and the good doctor will be happy to respond.